Hello, everyone. Thank you for joining us today for a sneak peek into this year's Pan American Society of Clinical Virology Fall Meeting. My name is Ken Gavina, member of the PASCV Digital Outreach Committee, and joining me today, I have the pleasure of introducing Dr. Donna Wolk. Dr. Wolk is a professor and the Division Director of Molecular and Microbial Diagnostics and Development at the Geisinger Commonwealth School of Medicine, and one of the invited speakers at this year's fall meeting. Hi, Donna. Thanks for jumping on with us today.
Good morning.
So let's get right into it. Can you tell us a little bit about what you'll be presenting at this year's fall meeting, and what do we hope attendees will be able to walk away with?
Sure can. So I've been assigned and have the honor to speak about verification and validation of quantitative molecular assays, viral loads, and the like. And I'll be focusing specifically on verification of laboratory developed tests, which often require a little bit more attention, more sample size, and perhaps more validation and monitoring throughout the life of that assay because it is a laboratory developed procedure. And I think attendees who haven't done an LDP before will take away some examples and concepts that they will need to consider before they entertain bringing in a laboratory developed procedure into their clinical laboratory.
That's great, thank you. I was also wondering if you could maybe speak a little bit more about the VALID Act, as it is pretty topical nowadays. Maybe what it is and how this may impact the validation for quantitative LDTs.
It is. It's a very concerning subject and a concerning act for those of us in molecular microbiology who are actively engaged in laboratory developed procedures. And the reason it's concerning is because often laboratory developed procedures are targeted for illnesses or subsets of illnesses and subsets of population or sample types that are not in a part of the FDA cleared process. So, and probably never will be. So there's thousands and thousands of viral loads, quantitative methods performed by board certified clinical and molecular microbiologists and board certified molecular pathologists who are meeting patient care needs. And the VALID Act is aimed to try to remove the oversight from CMS and the CLIA law that describes laboratory developed tests and move it into the FDA process, which would slow things down, cost clinical laboratories and healthcare-based laboratories so much more in terms of resources, money, documentation, and really eradicate the ability of some qualified professionals to do laboratory developed procedures for the sheer impact of the extra paperwork they would have to produce and the fees that they would have to pay. So, you know, those of us in the molecular microbiology community really feel that the VALID Act has no place. There's no need for FDA to oversee these functions when CMS has a perfectly useful and historically proven method. You know, if you think about it, Kenneth, you know, how often do you see on the news patient safety issues associated with laboratory developed procedures? Let me think, never. So knock on wood, I mean, but really it's not a common thing. These are qualified, highly trained, you know, my daughter used to say, Mom, you're in the 26th grade. And all of us who are doing laboratory developed procedures are that qualified. And so we feel that the CLIA instructions are clear and they've been able to be followed and maintained with the highest level of patient safety and laboratory accuracy throughout, you know, decades. So we see no reason to change that.
That was a very fantastic and well-worded answer. Thank you so much. And I also want to thank you on behalf of clinical laboratorians everywhere for acting as a voice for us and really speaking, I think, what a lot of us are also thinking as well. As someone who personally has a large passion in molecular diagnostic development, I'm really looking forward to your session later this month. So again, Dr. Wolk will be presenting at this year's PASCV Fall Meeting, September 22nd and 23rd in Chicago. Registration is still open, so don't miss out. I'd like to thank again Dr. Wolk for joining us today. And to the rest of the viewers, we'll see you down in Chicago. Thank you so much.
See you there. Bye.